And we will continue to follow this algorithm with regard to age and comorbidities. All of this being said, we look forward to making this vaccine available to all of our essential caregivers and that are interested in receiving the vaccine in the coming months. Once again, I want to pause and reflect on how much this is truly a historical event and moment in our nation. Thank you to everyone who worked so tirelessly to make this vaccine possible, and to all of the healthcare workers here at GW Hospital and across the world who are getting us through this unparalleled time and helping us save lives. We could not do this without you, and we look forward to overcoming this together. Now I'm pleased to welcome Lillian from our Employee Health, who will be providing the vaccines. I'm also pleased to welcome our first vaccine recipient. Barbara Neiswander is a nursing supervisor in the emergency department. Barbara has been a long-standing ED nurse at GW Hospital. Her vast experience of emergency medical and emergency department nursing has allowed Barbara to educate countless of nurses in emergency medicine. Please go ahead, Barbara.
Hello, Barbara.
Hey, thank you.
Nice to meet you.
Nice to meet you.
Hi, Barbara.
Hi.
Welcome. All right. Can I just see your folder? Can you please confirm with me that this is your name and birthday?
It is,
And that we have pre-consented you before we give the vaccine process?
and you have.
And we have given you education about the EUA of the Pfizer vaccine?
You have.
Okay. Do you have any questions or concerns for me?
None whatsoever.
Okay. All right. And which arm will we be doing today for your vaccine? Great. I'll ask that you take off your jacket. Let's try it.
You have a shift today, Barbara?
I did. I'm working now.
Well, thank you. Thank you for all you're doing to keep us safe.
Okay. All right, I'm just going to wipe the site. Roll your sleeve up a little bit. And this is a vaccine of 0.3 mL. Okay, we'll ask for you just to hold that up. Thank you. All right, Barbara, nice deep breath. 1, 2, 3, little poke. And all done.
Did it hurt, Barbara?
Not at all.
All right. That's what I like to hear.
First one.
Congratulations.
All right. Congratulations, Barbara, on being the first part in this historic moment and being vaccinated. All right. Very well. I'm now thrilled to welcome our second recipient. Our second recipient is Dr. Raymond Pla, an anesthesiologist. Dr. Pla's work as an anesthesiologist brings him in close contact with COVID-19 patients in the emergency department as well as on labor and delivery. He helps to manage the airway of COVID patients, which represents the highest risk to healthcare providers. Dr. Pla.
Doctor, you know I'm an anesthesiologist too, right?
I do.
All right,
Thank you
all
for your
right.
service to the nation.
Certainly appreciate what you're doing.
Well, thank you.
Hello.
Hey there.
Oh, can I actually just have your folder? I want to confirm your name and birthday.
Just make sure. Safe.
Okay, and this is your name and birthday?
That is correct.
And we provided you with the EUA of the Pfizer vaccine.
You did.
Do you have any questions or concerns?
I do not.
We'll be doing your left arm today.
Yes.
That sleeve come up faster, you'll be able to get to your door.
Oh, yeah.
Get the guns out. Maybe able to bring the sun out.
How long ago did you extract the syringes? Did you do the syringes to extract out of the vial?
That was done in pharmacy, and I picked them up at 2:15.
Oh.
Okay. All right. Nice deep breath.
Rock and roll.
Okay, little poke. 1, 2, 3.
All right.
How'd it feel?
Okay. Well,
Nope.
fine.
No problem?
Done.
And as she puts your Band-Aid on, why is it important to you as an African-American man to be among the first to get vaccinated?
You know, I know that there are a couple of factors at work, and I think this virus, this pandemic, has shown a bright light on the healthcare disparities and the extraordinary burden of death that has occurred in Black and brown communities because of, in large measure, because of the comorbid conditions. And then there's another layer there, and that is a certain amount of deep mistrust that has its roots in historical wrongs, but I think that the ongoing disparities that exist and latent bias and sometimes conscious bias kind of fuels and furthers that mistrust of vaccines and of the medical community more broadly. And so I think it's important for Black and brown communities and members of said communities to see someone who looks and walks and understands the stories and understands what's going on, and that this person looks like me and understands me and feels safe and trusts the virus, or trusts the vaccine, and feels comfortable getting it, and perhaps I need to rethink this, and at the very least ask my doctor, do you really believe, and do you and take that step forward, take that leap, because this is not just the best way forward, this is the best only way forward. This is the only way forward.
And I think that's a key. Ask your doctor if you have questions. Don't let misinformation be the reason you aren't getting everything that you deserve to be your healthiest self. And I want to be clear, because a lot of people don't know an anesthesiologist is a doctor. You went to 4 years of medical school.
I did.
You did 4 years of residency. You are a licensed physician, correct?
Yes, sir.
And you felt this vaccine was safe, correct?
Absolutely.
All right.
Absolutely.
Well, thank you so much, sir. We appreciate
Thank you.
it.
Thank you very much.
There you go.
Oh, thank you.
Thank you.
Doctor, a little memento of today, in addition to the vaccination.
Thank you very much.
Thank you. Thanks for doing this.
Thank you. I'm now pleased to welcome our third vaccine recipient, Dr. Shetal Sheff. Dr. Sheff is an obstetrician working on labor and delivery. She works in close contact with women who are known or could be positive for COVID-19. She works very hard to ensure a safe and healthy delivery process for both mother and infant. Dr. Sheff.
Welcome.
And Doctor, as she preps, Secretary Azar instructed us just 2 weeks ago to put out a action plan highlighting that 700 women die during the time of childbirth each and every year from pregnancy-related complications. And we unfortunately heard that 1 in 4 women have said that they have skipped or not been able to go in for their prenatal care appointment because of the pandemic. What are your thoughts on the significance of this vaccine for pregnant women?
We are really lucky here at GW to have the vaccine available, and we're so grateful to the administration for pushing the vaccine through. I think this will re-welcome our patients back. It's going to be protecting our healthcare workers as well. We've been utilizing an app to help patients remotely contact their physicians, but there's nothing that's greater than the actual in-person visit to really connect with your healthcare providers and create that trust that is vital for expecting parents.
And to be clear, what do you say to your pregnant women about when they can get a vaccine?
So currently, the American College of OBGYN and the Society for Maternal Fetal Medicine has put out a statement that despite there not being data yet available, that lactating women, people who are expecting, and people who want to get pregnant, that the vaccine should not be withheld from them. And just like any of the decisions that we make on labor and delivery, we do it with our patients. So it'll be opening up a conversation to let patients know that the vaccine is available, and if they're candidates for it and they are willing to take the vaccine, that we will encourage them to do that as well.
Thank you. And one of the safest things we can do for our pregnant patients is to make sure their providers are protected. So thank you for being here today.
Hello.
Thank you, sir.
All right. Can you just confirm that this is your name and birthday on the consent form?
That's me.
And that we have consented you prior to vaccination, and that we have provided you with the education emergency EUA of Pfizer BioNTech vaccine.
Yeah.
Okay. Do you have any questions, concerns before I proceed?
No.
Okay. And which arm will we be doing today?
The right.
The right. Okay.
Well, let's just do the left. That's
Are you
fine.
sure?
I'm fine. Yes.
Which ones you're delivering on?
It's good to be ambidextrous.
All right, and I'm going to ask you to just hold your scrub top up. Just going to wipe here, a little cold. All right, nice deep breath in through your nose, out through your mouth. Little poke, 1, 2, 3. All right, all done.
You are an excellent inoculator.
Thank you.
You didn't know you were going to get that. All right.
All right, and there you go.
Thank you for taking care of our mom.
Of course.
Congratulations and thank you, Dr. Sheff. I'm pleased now to welcome our fourth recipient, Charlie Stewart. Charlie is a nurse on labor and delivery, and as a nurse at the bedside of a laboring mother, Charlie is a wonderful advocate for her patients, ensuring that the delivery process is always patient-centric. Charlie.
Welcome.
Thank you.
I just want to confirm that this is your name and birthday.
Yes.
And that we have provided you with accurate consent and information about the COVID vaccine.
Yes.
Okay. Do you have any questions or concerns for me prior to proceeding?
No, thank you.
No. Okay. Which arm will we be doing today?
My right.
You're right. Okay.
You can just trade places.
Let's switch sides.
Perfect. Sorry.
Sure. No problem.
Delighted to be joined by Mayor Bowser.
All right. Just going to feel a little wet. Nice big wipe. Nice deep breath in through your nose, out through your mouth. Little poke. 1, 2, 3. Well done. Great.
How did it feel? Did it compare to a flu shot experience?
Yeah, very much so.
Similar?
Yep, not bad at all.
Great.
All right. Let me just complete your paperwork.
Thank you.
There you go. Congratulations. Of course.
Thank you, Charlene.
Thank you.
All right, thank you so much, and I'm now pleased to welcome our 5th recipient, Dr. Sean Chester, a physician in emergency medicine. Dr. Chester cares for all patients who present to our emergency department. Dr. Chester is often the first physician to diagnose a patient with COVID-19 and is responsible for safely discharging a patient either to home or admitting them to the hospital, sometimes even to our critical care unit. Welcome, Dr. Chester.
Hello. Welcome.
Hi.
Hi. Can I just please confirm that this is your name and birthday in the folder?
Yes, that is correct.
Okay, great. And we have previously consented you and provided you with education regarding the EUA and the Pfizer vaccine for
Yes,
COVID-19.
that is correct.
Do you have any questions or concerns for
I
me?
do not.
Okay, great. And lift your shirt up. If you could just hold the sleeve, that would be great. Okay. Nice big wipe, nice and cold. All right, little squeeze. Nice deep breath in through your nose, out through your mouth. Little poke. 1, 2, 3. And done. Okay.
Awesome. Thank you so much.
Congratulations. You're welcome.
Thank you so much.
You're very
Thank
welcome.
you.
Thank you so much.
Thank you.
All right, it is my honor to celebrate the first 5 vaccinated individuals at George Washington University Hospital, and we look forward to vaccinating many more. Thank you all for being here today as we begin our exciting new vaccination process. And I'm now pleased to welcome the Mayor of the District of Columbia, Muriel Bowser. Thank you, ma'am.
Thank you. Well, good afternoon, everyone. I am delighted to be here. I want to thank you, Secretary Azar, Surgeon General. Thank you for your leadership. And to all the wonderful doctors and nurses and healthcare professionals here at Washington, D.C.'s George Washington University. Please give them all a hand. We are very happy today. I gave my briefing about COVID. And certainly we all can recall how difficult the last 9 months has been in fighting this global pandemic. We're very grateful to the people of Washington, D.C., the business owners of Washington, D.C., who have heeded our advice and helped us best contain this virus as much as possible to get us to this day. The day when this vaccine starts going out, people start getting this vaccine, get all of their questions answered so they can inoculate themselves and their families from the COVID-19 vaccine. Today I was with one of our first responders, actually several members of DC Fire and EMS. And they will be among the first D.C. government workers who are part of the medical community who will be inoculated starting this Thursday. And so the stories that we heard from them are that they're doing it for their city so that they can go out and do their job safely. They're doing it for their own families. So when they go out to work each day exposing themselves, they know that they aren't then exposing their families. And they're doing it so that we can get back to normal just as soon as possible. So I am grateful for what I know has been a Herculean scientific effort, logistics effort, and now it's on all of us to make sure that we're communicating to our neighbors, our family and friends, and especially right now the healthcare workers in our lives, that we have a safe and effective vaccine, and we need to get to using it. So thank you very much, DW, for hosting us today. Thank you, Mr. Secretary, for all the work and that I know thousands of people have been engaged in to get us here to this day. And I would be remiss if I didn't remind everybody, let's have a safe holiday. The best way to have the safe holiday is to wear your mask and to stay at home. Thank you, everybody.
Thank you. Next, we will have Secretary Azar provide us some closing remarks, please. Thank you.
Well, Mayor, thank you for being here. We're so delighted to be with you today. Thanks to President Trump's sponsorship and support of Operation Warp Speed, Hope and Help are on the way. The vaccines that you just saw distributed are going to really be the light at the end of the tunnel. And I'm so delighted to be here at GW to get to see our heroic healthcare workers getting vaccinated and getting protection. It's so vital as the child of two healthcare providers to be able to see not just our doctors and nurses being able to get protected, but our janitors, our orderlies, our receptionists that are in harm's way who enable great institutions like GW Hospital to function and care for patients. And that's what these vaccines do. We literally, millions of doses right now are getting out there to the American people. And by next week, we believe we could be having a second vaccine. And by Christmas, 20 million Americans, by the end of this year, 20 million Americans could be vaccinated. By the end of January, 50 million Americans could have had a first vaccination. By the end of February, what you saw today could be replicated 100 million times, 100 million shots in arms between the first and booster vaccine. But all of that hope doesn't matter if we don't bridge to that point, which means we need every one of you to practice the responsible behaviors of washing your hands, watching your distance, wearing your face covering when you can't watch your distance, and especially be very careful and mindful to avoid settings where you're not going to do those things like indoor gatherings, overcrowded indoor restaurants and bars, and household gatherings that have individuals from other households, people from around the neighborhood, especially at this holiday season. We need you to be vigilant. Why do we need that? We need you to do that because we want everybody that's here now to be here for next year's holiday season. And thanks to the vaccine, that actually is possible. So now is not the time to let our guard down. This is not the end of our battle against COVID, but today marks a critical milestone towards the ultimate defeat of COVID-19. Thank you all very much, and thank you to GW for hosting us today.
Thank you so much.
I know, and I work very closely on that. Oh, thank you. I wanted to make sure it was fair, equitable, and transparent.
Mayor, thank you. And we're going to be having our governor's call very soon. I think at 4 o'clock we're doing it again today if you're available. Great. Thank you for being here.
Thank you.
Thank you, sir.
Thank you.
My pleasure.
All right.
Thank you. You did fantastic.
Yes,
Oh my God.
Can we get some of the social distant group shots?
What background would you like? Is this or the vaccination area here? Whatever you prefer.
Right here, Frank.
Okay.
This background is really good.
Okay.
So, sir,
Good, Chris?
Yep. You guys still looking right here? More like that. Thank you very much. Thank you very much.
Thank you.
Thank you.
Thank you for allowing us to join you for this.
Absolutely. Thank you. It's been an honor. Bye-bye.
Thank you.
Very good. Fantastic job. And it's so great. Good job. Good. Amazing.
Yes, sir. That was some great time. Yeah.
How long have you been here at GW?
I've been here for 8 years.
Okay.
I started in oncology, and then I went to the cardiac cath lab.
Okay.
Got my MBA, and becoming here, pandemic, and employee health.
Oh, and how?
Definitely want to keep everybody nice, safe, and happy and healthy, and
Well, from a physical health standpoint, that's one thing. But how are you dealing with the mental health of the employees?
I actually greatly commend the employees. I think that they're doing a wonderful job, and at GW we definitely have a lot of resources for them should
Okay.
they need it. There's a lot of communication in our daily leadership about caring for the caregiver, and this is something that we really prioritize for them. So, and employee health is just always an open door.
Okay.
Another resource for them.
So who are we going to vaccinate today? I see you've got a...
So we will be vaccinating our frontline staff.
Okay.
We will be vaccinating 2 nurses, one from the emergency room, one
Okay.
from L&D, and then we will also be vaccinating 3 physicians,
Okay.
1 anesthesiologist, 1 L&D attending, and then 1 ED attending.
Oh, wonderful.
Mm-hmm.
That's really tremendous. How many doses did you all get for GW?
We got about 925.
For GW?
Yeah.
For the system? Okay.
Yeah.
Great. And what % of your healthcare workers will that cover?
Oh, I don't know the percentage, but it will cover a lot of them. There's definitely a lot of interest with the survey that we put out for the
Okay.
allocation process. A lot of interest in the vaccine, so I just hope that supply chains keep going and we can keep administering as many as we can.
Now, are you looking at the breakdown of who is raising their hand according to demographics And the reason why I asked that is because the Nursing Home Association reached out to me. Oh, okay. Oh, I didn't realize you all were. Yeah. The nursing homes were wanting to make sure that particularly people of color were interested in the vaccine, even among their workforce.
Yes, absolutely. This is Dr. Paul, one of our anesthesiologists. He is African American, and he definitely, and I definitely agree that this is a top priority, especially for that community. And we just hope that we're able to provide an outreach service so then people feel comfortable and confident in not only the vaccine but also in medicine itself.
Great. And for your employees, if they have questions about the vaccine, how do they get those answers?
They get the answers through our staff, which we are provided through the EUA
Okay.
that Pfizer's provided us. And I have to say they have been doing a wonderful job
Really?
with
Great.
educating the staff. They're professional, definitely available for any questions that we may have. And I'm definitely proud of the process. It's been great.
Okay. What's the most frequently asked question or questions that you're getting on the vaccine?
Right now, the most frequent question that we have about the vaccine is about the side effects.
Mm-hmm.
And we feel confident with the doctors that we have spoken with that the side effects are pretty similar to other previous vaccines.
Okay.
So it's if you've had a vaccine before, you can feel confident in this vaccine.
So when it's at the injection site, maybe a little headache or mild malaise or mild fever within the first 24 hours or so, but goes away.
It goes away, especially with our infectious disease doctor. They are definitely confident in that.
And I have given the flu shot to several people this year, but is the technique the same for this vaccine? Are you giving it in the deltoid?
Yes, the technique is still the same.
Okay.
It's the ion shot into the deltoid. With alcohol.
If you need it, it's in the
Have them move their arms to have some mobility and get that vaccine in.
Exactly. Well, so when are you going to get yours?
As soon as I'm allowed. Not quite frontline as everybody else, but I'm definitely signed up and eager to get it.
Okay. Wonderful. Well, thank you again.
Thank you so
Appreciate
much.
it.
Thank you.
Indeed.
It's a wonderful day and event and everything that's been going on, so it's definitely landed in good for me.
The beginning of the end. Doesn't mean we're there yet, but
Absolutely. It's
but
a
we can
marathon.
see the finish line. Well, thank you.
Thank you so much. Nice to meet you.
You too. All right.
If you could come with me,
Yes.
please. Thank you so much.